Hi, good afternoon or good morning, depending where you are in the country. My name is Robin Lipkowitz with NCSL's Early Care and Education Project, and I want to thank everyone for being on the webinar call, Integrating Early Childhood Data, What Legislators Need to Know. We also have with us our project staff, Julie Poppy and Allison May, on the line today, and a nice broad listening audience of legislators, legislative staff, and other stakeholders across the country. Just a few things for today's webinar. Our presenter, Carlise King from the Early Childhood Data Collaborative, will talk about how integrated early care and education data can inform policymakers and help answer questions about young children, families, programs, and services in their state, as well as how accurate data is important in understanding and improving program accountability. The goal of today's webinar is to provide you with information on why early childhood data is critical for program accountability, how integrating early childhood data can help legislators. Carlise will also talk about some state success stories from New Jersey, Illinois, and Utah, and then we'll wrap up with potential questions and policy considerations for legislators. We know that some of you may be participating only via phone and not the webinar platform, and we appreciate your ability to join and listen in. There'll be an archived copy of this webinar that'll be available and posted to the NCSL website shortly. So our goal for the next hour is really to make this presentation as interactive as possible. So should you have a question, you can put it in our chat box that you'll see on your computer screen, and Julie and I will, and Allison will be moderating the questions and passing them along to Carlise. So again, trying to make this as interactive as possible, and so we will be taking questions during the process of the webinar. So if you missed all that, don't worry. The operator for this call will explain the procedure to you as we move into the question and answer part of the presentation. So before I turn the call over to Carlise King, I wanted to give you a little bit of information about her. Carlise King, she's the Executive Director of the Early Childhood Data Collaborative at Child Trends. She has over 15 years of experience conducting state and national level research on early childhood issues and examining the impact of state and federal policies on parents' access to child care services, licensed child care supply, child care costs, and the child care workforce. And with that, Carlise, I will turn the platform over to you.
Thank you, Robin. Good afternoon and welcome, everyone. I'm so pleased to have so many people that are joining us today, as Robin was saying, to talk about the importance of integrated early childhood data systems and really thinking about how they can help guide accountability systems to monitor the use of state funds and program outcomes. So just a quick overview. For my presentation today, I'm just going to first give you a little bit of background on the Early Childhood Data Collaborative and some of the work that we've done to date, and then discuss why focusing on early childhood data is important and a little bit about what the barriers are in integrating early childhood data. Next, I'm going to share some examples of how integrated data can help policymakers have good information about how public funds are spent, who they're serving, and what are the short and long-term outcomes of state investments. One of the wonderful things is that the work to integrate early childhood data has grown over the last several years due to federal and state investments. I'm going to share some examples from different states about the successes that they've had in integrating their early childhood data, and then end with a few policy options for you to think about that you could apply to improve access to early childhood data in your state. So as Robin mentioned, please, if you have questions throughout the webinar, post them in the chat box. But we'll also have a period at the end of the webinar and save some time to have an open discussion as well, because we'd like to hear from you as well. So Robin gave a little background about me, so I'm going to give a little background about the Early Childhood Collaborative. It was established in 2009, and our mission is really to support policymakers by promoting policies and practices that focus on not only the development of integrated early childhood data systems, but also their use in decision-making and for early childhood policies. One of the things when the Early Childhood Data Collaborative started is that understanding the evolution of the funding for early childhood early care and education programs has resulted in a configuration of programs which really differ from state to state. And based on that, the Early Childhood Data Collaborative has moved forward with creating a framework for developing systems with the goal of really helping states transform their data systems into ones that have typically been used to collect data based on funding reporting requirements, to data systems that are really improvement driven and can provide feedback to policymakers and program administrators that can be used to guide decision making. So, however, based on a lot of the work that we've done, we know that current systems are fragmented and not able to collect a lot of this information currently. But when integrated, these data systems can really help policymakers look at issues of program quality, understand what the workforce development needs are in the early childhood field, as well as think about access to high-quality programs and school readiness outcomes for children in high-needs areas. And part of the way to do that is really shifting from what has been more of a snapshot of information that policymakers have received about what's happening at any given time with children in programs, but doesn't really help policymakers understand how children are benefiting from participating in different programs over time, and whether our investments to improve the quality or to build the workforce for early childhood programs are improving over time. So one of our main visions is really that we develop systems that policymakers, practitioners, and parents can use so that they have access to not only high quality but timely data to make decisions that can really improve outcomes for children. To date, ECDC has worked with local, state, and national early childhood leaders to identify key policy questions to guide the development of early childhood systems, as well as focusing on critical components of a data system that's needed in order to answer questions across all of the early childhood programs. We've also conducted 2 national surveys to assess states' current capacity to collect early childhood data and use it to answer questions around what type of services children are receiving. And then we've developed policy briefs looking at where there are gaps in data collection, specifically around states working to increase the data that's included in their state data systems related to Head Start, as well as our more recent report that was sent around with this presentation that looked at the strategies used by 7 states that received funds through the Early Learning Challenge Grant aimed at improving their early childhood data collection system. All of these documents are available on our website, but next I want to talk a little bit about why early childhood data is important. And I'll be sharing examples of the strategies that we heard from our Stacking the Building Blocks brief, as well as highlighting examples from states that we interviewed and highlighted in some of our previous reports. So why early childhood data is critical. We know from research that the period between birth and age 8 is a critical time of development for young children, and that the right interventions at the right time have the potential to change a child's learning trajectory, resulting in positive health, learning, and economic outcomes later in life. The gaps in children's learning and development appear well before kindergarten and continue to grow over time. So supporting a children's optimal development early allows policymakers, teachers, and parents to have the information that they need to have the greatest impact on children's physical, cognitive, social, and emotional development. And so the need for data during this period is also critical, so that the appropriate interventions and support can be provided at the appropriate time to those children with the greatest needs. So how do we support children early really has consequences for what additional supports children may also need later in life. And then one of the reasons focusing on early childhood data is critical is because what we know from the surveys that we've conducted and the information that we've gathered from states is that data about young children, including having longitudinal data that allows us to look at changes over time, are not typically connected or accessible to policymakers or even those at the program level to be able to use to really look at early childhood investments. So what do I mean by early childhood data? For the purposes of our state systems, our assessment of state systems, the Early Childhood Data Collaborative has defined early childhood as the following 6 early childhood programs, although I recognize that there are many other publicly funded programs that also contribute to children's early learning that are not captured here. But we've chosen to focus on these 6 and to talk about them in the examples that I'm giving because they represent 6 of the major state and federal sources of funding for early care and education. So first, early intervention and preschool education provides services for children diagnosed with developmental delays and disability. Federal and state-funded Head Start provide early care and learning services for pregnant mothers and children birth to age 5, earning less than the federal poverty level. For state pre-kindergarten, this focuses on children ages 3 to 5 or 2 years prior to entering kindergarten. And in most states, the eligibility varies from universal access to those that meet a specific defined income eligibility or need-based criteria. For subsidized child care, this program focuses on children birth to 13 and is funded through the Child Care Development Block Grant for children living with families that earn less than 85% of the state median income, and is focused on serving families that are income eligible that are working in school or attending job training. And then last, home visiting programs provide in-home support to at-risk pregnant mothers and parents with young children, again focused on supporting parents in a home-based setting to address developmental needs of their young children. So one thing to note about all of these programs is that they all receive funding from different places. They focus on different age groups. They have different target populations and eligibility criteria. So in looking at the next slide, this graphic shows each of the programs I just described. And one of the things that it's important to know is that all these programs have the potential to overlap in the children and families they touch. However, each program has different eligibility requirements, curriculum, and program goals. And these are also administered through different agencies, from state agencies, such as state preschool information generally housed in departments of education, and subsidized child care programs being administered through departments of human services. So this poses another challenge and gives you a little bit of background about why the information around children are disconnected, because the programs, how they were developed and funded, really started in different places. But again, when we're talking about early childhood and early childhood investments, we know that children may be served in one or multiple of these programs at one time or throughout their development from birth to 5. So it's important to understand not only the impacts of one program, but also the collective impacts of all of these programs. And so when we spoke to states about their capacity to connect information about children in these programs, there was really only one state, Pennsylvania, in our survey that had the capacity to connect information around all of these programs. And I think that this was in our 2013, so there may be more since then. And then when we looked at the ability of programs to connect early childhood data to other services a family may be receiving, or how children progress once they enter school, the connections go down even more. And so one of the things that states have been focusing on is what type of information do they need from what programs, and then also to answer what questions. And so the next question, again, in beginning, is what is the benefits of connecting the information from all of these different programs? And so I have a few questions that come from state examples of questions that states have addressed, and also build off of some of the policy questions that the Early Childhood Data Collaborative has identified. So first, one critical question to really support how state funds are being used is, are there certain populations that are disproportionately underserved by child care subsidies? One question that a lot of states are really trying to use their integrated data systems to answer is to really get a sense of who's being served by which programs, and whether or not the goals of the programs to target services to high needs and low-income children are happening, and what is the distribution of those funds, and whether or not children are being served in one program or multiple programs. And this can help policymakers to more efficiently distribute resources to children and target resources to reach children with the greatest needs. The second question, do children receiving subsidized care, particularly in high poverty areas, have access to high quality programs? For children to benefit from participating in early childhood programs, we know from research that quality matters. The Race to the Top Early Learning Challenge funds and other investments have supported states to increase access to higher quality programs for low-income children, but without information about where children are served and what the quality of those programs, it's difficult to know if the goals of these initiatives are being achieved, and also for who are they being achieved. Next, integrated data systems having information across all of these programs can also help policymakers answer questions around what the barriers for working families are to access early care and education programs. Are there waiting lists for some services? Do parents in different programs utilize different types of care based on the program they're in? This can support policymakers' decisions related to program eligibility, reimbursement rates, and funding to make sure that the program is able to achieve its stated goals. A fourth question is, what policies and investments lead to a skilled and stable early childhood workforce? Are workforce initiatives working to build the strong early childhood workforce that states need as they consider expanding access to early childhood services to make sure that they have enough quality teachers, and that the current professional development systems are preparing teachers with the professional development and training that they need? And then last, policymakers need information about whether or not programs are achieving their stated goals. And this may be looking at the effects of multiple interventions that are being funded at the state level, but then also having clear metrics and indicators to look over time about whether or not specific goals are changing and improving, specifically around access for children, work stability for families, and quality for programs. So before I move into the state examples, I would just like to pause for any questions. I know that that's a lot. Or if there's other questions that you're particularly interested in answering, or challenges in gathering data that you or strategies that you'd like to share. As Robin was saying, we'd like this to be an open discussion with everyone. So I'll pause for questions right now.
Yeah, so please, if you do have questions for Carlise up until this point, please put them in the text box, and then we will be reading them, moderating them to Carlise for answers. You know, one thing that that might be a point to consider too for the policymakers on the line are, do you feel like in your state that you have the data that you need to best inform your policy decisions? Okay, Carlise, we do have one question. What are the costs associated with such programs?
And when they say programs, do they mean the individual early childhood programs or the integrating the data systems? Could they clarify that?
Just one. Oh,
okay, I see that. Well, I can't speak to any particular state, exactly what their total budget is. I can follow up offline with some examples that we've gotten from some states. As far as when we've spoken to states about how they're funding these systems and the sustainability of them, we've heard different approaches. Some states have been using parts of their state longitudinal data grants to also expand and include early childhood as part of that system. The Early Learning Challenge Grant funds, as I mentioned before, had an area where states could focus on data systems, and several of the states that received those grants are using those funds to do that. And then there are also different opportunities with the Preschool Expansion Grant to have states think about linking preschool data with other systems. And then some states have used state funds to expand their systems with the idea that coordinating this information can create reduce duplication and create efficiencies in data collection that can be shared across agencies that are collecting the same information from the same families and children, that they can all benefit from that.
Thank you, Carlise. We have another kind of important question. How do states with successful ECE programs integrate with their public schools to ensure a continuum of education and services?
Well, I would say from what we've seen from states that are integrating their data, linking their preschool information with their local schools, through their local schools and also through their state data systems is the one that we most frequently see. One strategy that we've commonly seen is assigning a unique identifier that's used within the school system during the early childhood years. So this allows information that's collected before a child enters schools to then be connected with the public school systems. And so that's part of sort of the work that a lot of early childhood and other agencies have been doing and thinking about how can we standardize the way that we collect data so that we can more easily share that. And looking into a common identifier is one way that they've been able to do that, as well as looking at common assessments and standards just to make sure that what is being taught in early childhood and then what is being then built upon when a child enters kindergarten is being supported and reinforced on both ends. So I would say there are technical approaches to working with the public schools as well as programmatic and workforce and training and professional development that's happening to make sure that communication and that work that's happening together is strong.
Okay, I think we'll have time to take two more before we move on to the next section of the presentation. So we have a question that's come through. How are issues with data privacy addressed by integrative systems?
That is a great question, and I'm going to get into that a little bit more in my next section. But one of the strategies that states have been working on is developing data governance systems. So developing specific policies to make sure that federal and state data privacy and confidentiality rules are being adhered to across all of the programs, because while there are some policies that are similar, there are also different policies based on the type of information that's being shared and also at what level. Developing specific data sharing agreements that specify exactly how the information is going to be used and who has access to that information, and again, at what level. And then also spelling out specifically how data will and will not be used or shared. So this has generally been happening through data governance councils that have been being developed in states. And based on our survey, we had about 32 states that indicated they had established early childhood governance structure to work specifically on that issue and making sure that they're coordinating the security of data across all of their programs.
Great, thank you. And so we'll have one last question before we move on, and I think this question will kind of nicely lead us into the state success stories. So one of the last question is, what are major barriers that state agencies or community programs cite in sharing data? And are there examples of policies in place that can help overcome these challenges?
That is a big question. There are a lot of answers to that. I would say there are several barriers that we've heard from states. One, I think, is a lack of consistency in the type of information that's being collected across the different programs. So even when you're able to combine it, there are still additional changes that need to be made in order to have data that's collected in different systems collected. One is that depending on the different programs, you have these older legacy systems, and you have data that's collected from web-based to be very advanced to paper and pencil in some in some programs. So depending on the program, there's not consistency in the technology or the capacity to be able to collect the information. I think as we were talking to states, particularly around the Early Learning Challenge Grant, making sure to find the staff that had the capacity and the knowledge in order to bring all these different systems together was something that took time, as well as making sure that you have the internal capacity to be able to analyze and clean a lot of the data that's there, because just bringing together the data is one piece, but once it's all together, there's an issue of data quality to really be able to transform the information to make it usable by policymakers.
Okay, thank you, Carlise. So now I guess we'll move into the second part of your presentation, and then there'll be time for questions and answer at the end. I also just wanted to say that, we're getting a lot of questions that are coming through. We obviously won't be able to get to all of them, although we'll do our best to get through as many as possible, but we will follow up either individually or through our email and listserv with answering the questions. Okay, back to you, Carlise.
So as I was mentioning earlier, one of the questions, and then many of the questions that we got here, is what are states doing to address this issue? When we spoke to 7 states, as I mentioned before, that had received funding through the Early Learning Challenge grant, we asked them that exact question. And we found that they had focused really on these 5 main strategies to really begin putting in place what they saw as the critical building blocks to strengthen the foundation of their early childhood systems. Because I think one important thing to note is that there's already a lot of data that's being collected. These systems are not necessarily generating new data in these cases, but it's really transforming the way that data is collected so it's more efficient and more usable by practitioners and policymakers. And so I think the first thing that states had mentioned is really creating a vision for their early childhood data systems. Essentially, what are we collecting this information for? And part of bringing together all of these different early childhood programs is coming together with common goals and metrics across these programs to examine quality, assess unmet need. States wanted to identify the patterns of use so that they could have timely data to allocate resources where it was most needed. So I think for the questions that they were really trying to address, a lot of it was really just getting a handle of how all of these programs fit together and how resources were being allocated to who and what the utilization patterns were in different areas of their states. The second piece I talked a little bit about before is developing these early childhood data governance structures. And these are really structures that are focused on, that develop policies and procedures that guide the security of data collection, the access, and the use of the data. As I mentioned before, because early childhood data is housed in multiple agencies and managed through various funding streams, the governance structures are really an avenue that are essential component for coordinating the data to ensure that at all levels and points of entry, data security is adhered to, and the decisions about how the data is going to be used and collected are consistent across the programs, and that these are transparent processes to not only programs but also parents about how the information is collected and used. And the states spend a lot of time meeting with internal and external agencies, developing MOUs to get down to the details of exactly how the information is going to be shared, and then also developing security protocols to determine who would have access to the data and at what level. The next piece is identifying information gaps, because even though there's a lot of information collected, there's still areas based on the questions that states had where they didn't have information that they needed. And states identified information gaps around child-level information, again, related to children being served in multiple programs, with really the goal to streamline the services and the funding to meet the needs of as many children and families as efficiently as possible. The second was information around program quality. So, for example, Minnesota was focused on connecting data about the quality of their state preschool programs. And then also a lot of states were focused on having more comprehensive data on their workforce so that they could make strategic decisions about allocating funds for professional development resources and to better understand the impact of the current educational and training investments that they'd already made. The fourth is related to the more technical pieces, being around in order to connect the system. So as I was saying before, assigning unique identifiers for programs, children, and staff, and really getting to more the technical and the system level things that needed to happen so that the information could be connected. And that's data sharing agreements as well as memorandums of understanding about how agencies are going to work together. And then last was this issue of staff capacity, of sustainability, and thinking about the capacity of these systems to move forward. Several of the programs that we spoke to were leveraging funds through the Departments of Education and their state longitudinal data systems to incorporate some of their early childhood data into those systems while using this additional federal investment. Some other states were assessing their current expenditures on data-related services to see if there were efficiencies that could be found in combining all of the current data efforts that were happening. So at the point that we spoke to states, they didn't necessarily have the specific plan in place, but we're at the point where they're still looking how they're going to sustain this moving forward. So next, I'm going to go over a few examples of states that have already started to answer some key policy questions and address gaps in their current data collection. These systems do more than what I'm about to share as examples. And really my goal is to give you a snapshot of what integrated early childhood data systems can do and how states are approaching their development. So first is Pennsylvania. This is a state, as I mentioned to you before, based on our 2010 and our 2013 survey, has been able to link data from all of the early childhood programs that we'd identify. And Pennsylvania's Pelican system is developed as a partnership between their Department of Public Welfare and their Office of Child Development and Early Learning. And it's their early learning network that collects information around child assessments, teacher and program level information to inform Pennsylvania's initiatives, services, and then also to support program evaluation and improvement. The goal of Pennsylvania's Pelican system was to help staff track and evaluate program results and to improve the effectiveness and the availability of state early childhood programs and to provide more specific information about teachers and children in these programs. Through their Pelican system, policymakers can access detailed reports around child enrollment, early learning outcomes, as well as state qualifications. They're able to track project progress in reaching all children from birth to 5, as well as assist communities to better understand and identify early childhood needs. Because their data is linked, I know there was a question earlier about how states were connecting information with their public schools. Because their data is linked to school outcomes in kindergarten and 3rd grade, policymakers also have access to understand trends over time. Having information across all of these programs provides policymakers also with information to determine community need and where programs, how services are being distributed throughout the state. So this is a graphic. No need to understand and focus on every single box. The main purpose is to just give you a sense of the integration of the different pieces for Pennsylvania's data system. You can see in the center they have sort of this executive dashboard, and then around it, it has several different programs that are focused on early childhood that either feed into other systems on the outside of the box or inside. But in a simple form, what they've done is they've created a single integrated subsidized child care system that centralized data to allow programs to effectively manage their programs. It allows them real-time analysis for monitoring and allocating service dollars to move children off the waiting list and then to maximize the number of children served. It has also provided them a means to also address data reporting requirements that they had to reduce the time and effort to create state, local, and other management reports because they have all of the data in one place. For Utah, another thing that early integrated data systems can do is that it can help policymakers develop and raise awareness around their questions. Utah's Early Childhood Comprehensive Data Integration System actually integrates data through their Department of Health, through their system, their Child Advanced Record Management System called CHARM. One of the things in the examples I wanted to make sure to highlight is that, again, in different states, depending on where their early childhood programs are and how these efforts have developed, in Pennsylvania, as I was saying before, it was their Department of Public Welfare and Education, and here in Utah, it's their Department of Health. And for Utah's system, some of their key questions were really around identifying of those children eligible in Utah, how many were receiving no services, how many were receiving multiple services, to, again, get a sense of what's the crossover between any pair of programs and really get a sense of what is the reach of state funds and programs, and then what are the outcomes for children that participate. And in this case, you can see on the left-hand side are all of the early childhood programs that they include in their data system. And as you move to the right, they move into a more centralized database. And to go back to the previous question about capacity, I use this example from Utah because one of the things that they're in the process, if they haven't already completed already, is creating an interface for researchers where de-identified information can be accessed. So then again, as I was saying before, thinking about the capacity of how this data is going to be analyzed and used once the system is developed. Next, in Illinois, policymakers played a key role in setting the foundation for their early childhood data system. Their early learning data system is housed within their longitudinal data system. It includes data on children, teachers working in programs, and the goal is to, again, generate information for decision making at the state level. It was established through legislation that included a provision for early childhood data, a unified early childhood data, to be part of their P through 20 data system, looking from cradle to career, as some say, to be able to not just have a data system that focuses on early childhood, but that there's a connection for all the information from birth to adulthood. They're using their early learning funds to implement the work of developing this system. When we spoke to them, I think one of their major successes was their gateways to opportunities. One of the information gaps that they had identified was really not having comprehensive data on their early childhood workforce. Their professional development system now includes over 10,000 educators to get a better sense of, for what the relationship is between educators and the programs and where they're working and the children that they serve. And then last but not least, in New Jersey, and this is an example where policymakers can also use integrated data systems for resulting research studies to improve the capacity of programs. And so New Jersey's enterprise analysis system for early learning integrates data from multiple early care and education programs. One of their questions that they had was around outcomes for children's performance that participated in their state preschool programs. And so they had worked with researchers to conduct a study to look at what the outcomes were through 4th grade and 5th grade for children participating in their preschool programs. And in their case, they found significant gains for children that had participated. I think it's important to, again, as states are developing these systems, about what you can and can't use the data to look at. A lot of these data systems can show you trends, but when you're looking at outcomes of programs, you really want to make sure that you're working with researchers and other experts to make sure that appropriate comparisons are being made. And then I wanted to end with this. This is New Jersey's vision for their early learning system that they're building. And I think one of the things that I like to highlight in here is that you can see all of the programs that are envisioned as partners of this early learning system, and then through the rainbow you see that it's not just child-level information, it's really integrating child, family, classroom, program, and workforce data. Again, understanding that there are multiple parts that need to be considered as we look at improving access and quality across all of these programs. . So as policymakers, what can you do to improve access to early care and education information? I think one of the key things that we started with, and that many states have started with too, as I mentioned before, is really identifying what questions need to be answered. Early childhood data systems need to be guided by specific policy questions and clear indicators that you're trying to measure that are tied to program goals. You don't want to collect data just for the sake of collecting data. And so having that really be a key first step is really important in engaging those in your states around the development of these data systems. As Robin was saying, I'm sure there have been instances where there are specific questions or data that you needed that were not available. And I think working with, it's important to gauge early childhood leaders, researchers, practitioners, and parents as part of this process so that there really is transparency around what data is being collected, and in studying and using this data. And then policymakers, as I mentioned before, some of the examples from the states, strengthening policies to enhance coordination, security, and the use of data across sectors. To add to the previous question that someone had about what the specific barriers are, states have reported barriers when trying to share data across agencies. And part of this is relationship building and also having different systems and requirements. So thinking collectively across different agencies about how this can happen, again, what those critical questions are and what type of data would need for that is a role that policymakers can play, as well as supporting staffing and resources needed to translate information into actionable reports. And again, tying this to really a unified vision and specific policy questions that you would have for your system. So those are all the examples that I had to share for you guys. Robin, any additional questions come up as I was going through the second part of the presentation?
So if anybody wants to post their questions, I'll be happy to read them out to Carlise. But one question from before I'll read in the meantime. It says, could you elaborate on the capacity issue, like via your case studies? What are the HR needs and structures, the internal and external, like, for example, consultants, collaboratives, IT experts, coordinators, et cetera? Do you have any thoughts on that, Carlise?
Well, several. I can't specifically give you sort of a count of exactly this many researchers, this many IT staff. States have been approaching it in different ways, and some have an overall information technology officer that's either individual to their program or serves across the program. So a lot of it has to depend on what the current infrastructure are for the programs. I think we've seen some early childhood programs that have no research staff or capacity, and some that have quite a bit, those that are working sometimes with their departments of education. So I think the challenge with early childhood programs is that unlike departments of health or departments of education, depending on the states, they're not agencies within themselves. They're generally programs within a larger agency. And so their capacity is really tied to the capacity of the agency that they're housed within. And so as you're trying to create bridges across all of these individual programs, you may have one program that's coming from an agency that has a lot of capacity and one that does not. But one of the things that was specifically mentioned to us in the interviews was around putting together the team to begin putting together their data systems plan and needing to hire staff that had knowledge of the program as well as the data being collected. But I wouldn't say it's really a technology issue as more of it's a programmatic issue in working together and thinking about how these systems and this information can share. because generally IT can create a system based on what your needs are, but really sitting down across the table and determining across all the agencies what their shared needs are is what has been more of the process that states have been focused on.
Thank you, Carlise. Before we wrap up, do we have any other questions?
Oh, and then I'll just to add too, we have seen states that are using, working with universities or other research institutions as partners in helping them work through specifically questions around the data collection, analyzing it, and how to structure their systems. So I think we've definitely seen them consulting outside experts if they don't have the expertise internally to do the work.
Okay. So anyway, thank you so much to Carlise for sharing her information and her knowledge today on data systems. I want to remind folks about the resources that we have on the web. There'll be an archived copy of this webinar that'll be available shortly on our website. We are cutting and pasting and following up with the questions that have been asked that may not have gotten answered today. I also wanted to remind folks about the NCSL Early Care and Education database that can be found on our website, which also includes legislative examples of legislation related to early childhood data sort of collaboration, data systems, data sharing. So please feel free to look at that. And as always, please reach out to us for any questions you have. NCSL is here for you. So please do send us your comments or feedback, and feel free to email any of our staff members on the Early Care and Education team. Thank you, everybody, for your participation today. Have a great day.